This is part of a fun debate discussing whether a utilization of novel therapies like Brentuximab vedotin and standard chemotherapy and just set it and leave it and give all cycles of treatment would be a better strategy than utilizing a PET-directed therapy. And the reason for doing PET-directed therapy, which has been somewhat of a standard, is that the therapies that we've used have either been very intense, like escalated BIACOP, and the idea is to try and diminish how many cycles you need to give to avoid long-term toxicity, or in the case of A+AVD chemotherapy, where bleomycin had a lot of toxicity, to be able to drop that out of the combination. But what we're seeing now is new drugs like Brentuximab vedotin and possibly nivolumab, because there's data for that too, in combination with AVD chemotherapy, which is a less toxic combination, would allow us to utilize those drugs all the time and in fact show an improvement in progression-free survival, and in the case of Brentuximab AVD chemotherapy, an improvement in overall survival. So I think you're seeing more of a move back toward less toxic therapy in combination with novel agents, and just set it and leave it and not have to bother with the PET-directed approach.